Good afternoon, everybody. I think I might kick off. We've got a fair number of people joining us already, and I'm sure in the next minute or two more will be popping up on our screens. Welcome. Good afternoon. Welcome to this edition of the RISSB MasterClass webinar series. My name is Sharon. I'm your RISSB host today. But before we go further, I like to acknowledge the traditional custodians of the land where we meet today, and for me in Brisbane here today, that's the Turrbal people, and to pay my respects to their elders past and present. I also extend that respect to Aboriginal and Torres Strait Islander people joining us today. Today's spotlight of the webinar, the masterclass, is around managing occupational violence and antisocial behaviour in rail. And joining us to present that is Joe. Joe Saunders is the Group General Manager, Training and Consulting at RISSB Solution Group. And Joe is also the 2021 Outstanding Security Consultant of the Year. Joe's worked in violence management, physical security, workplace safety roles for more than 20 years. And Joe is the author and creator of the Holistic Workplace Violence Prevention Model. Now, this model is the world's first ISO 31000 aligned workplace violence prevention model and brings together the worlds of enterprise risk, safety, security, HR, communications, threat assessment, education, and well-being. So it is a truly comprehensive framework for managing the risk of occupational violence. And it's very topical for us to be doing this particular webinar with Rail Are You OK only last week on the 18th of April. And before I hand over to Joe, just a reminder for those of you who have joined us online, you can enter your questions into the Teams chat or comments anytime during his presentation, and then we'll cover them off at the end with Joe if you know, we will have ample time to do that. So with that, I'll just hand over to Joe, who will take us through the webinar masterclass today. Thanks, Joe.
Thank you very much, Sharon, for that warm introduction, and thank you everybody for making the time to attend this webinar. It's a really good attendance. I'm very impressed. So thank you very much to RISSB for inviting me, and also thank you all for being interested in this topic. It's certainly something that is unfortunately topical, and it's always a weird thing for me to introduce myself and talk about this topic, because on one hand, I wish it wasn't topical. I wish it wasn't something that we had to address. On the other hand, I am very gratified that so many organizations are taking it seriously now. I've been talking around the topic of workplace violence prevention for close to 20 years, and I will say that when I first got into this field, I got into it through healthcare, and outside of healthcare, there wasn't really a lot of conversation around protecting people from the risk of violence, aggression, psychosocial health, etc. And it's really gratifying to see in the last decade or so, but especially the last 5 years, we've started to see a lot more organizations getting on the front foot and trying to protect their staff. So kudos to all of you who obviously are a part of that, because otherwise you wouldn't have taken the time out of your day to attend the webinar. So thank you very much for that. As Sharon mentioned, the topic of the day is managing occupational violence and antisocial behaviour in rail. Before I dive into that, just to establish, I guess, where I'm coming from and where RISSB Solution is coming from. Firstly, RISSB Solution is a bespoke risk management advisory consultancy and manpower company. We provide consulting services, education services, and manpower solutions across a range of risks, including workplace violence, but also security generally, cybersecurity, medical and emergency response, workplace health and safety, and a variety of other risks also. So our approach has always been holistically, not just how do we address this with training, or how do we address this with better gates, or how do we train better guards or AOs, but rather holistically, what do we do to manage a risk? So that is certainly the approach that we try to take to everything we do, and certainly the way we've approached workplace violence or occupational violence and aggression also. My background is a weird combination of psychology and security. I started off as a psychology student who started working in the security industry to just not be broke, and it turned out that I had a real passion for protecting people and that became a focus of my career moving forward. In particular, protecting people and trying to prevent and or manage incidents of violence and aggression in people's workplaces. But I've also worked in a number of sectors across ranging from roles associated with terrorism and violent extremism through to domestic and family violence, and certainly a lot of work around workplace violence. So that's it in a nutshell, my background and why I'm passionate about this particular topic. So, look, we have a lot of ground to cover. The main goal of this webinar for me is to introduce you to the model that Sharon alluded to give you a framework with which to look at your own workplace violence or occupational violence and aggression frameworks and how you're currently addressing the risk, and hopefully stimulate some discussion and some interest from you. I would encourage you, please do use the chat box for questions. I'll do my best not to get sidetracked and answer them throughout the presentation, and rather just to collect them at the end as I've been asked to. But certainly if they come to mind and they're topical, feel free to put them in the chat box so you don't lose them. The other thing is I may ask you some questions. If I ask you a question, I'm told you can't come off mute, but feel free to reply or participate in the conversation in the chat if you wish to do so. So, with that in mind, I also did mention we have worked with a number of rail operators over the years. We've had an ongoing relationship with V-Line in Victoria for a number of years. We've also worked with Yarra Trams, Queensland Rail, and Sydney Trains, and New South Wales Rail Link as well. So, plenty of experience in this sector. So, first question for you, and feel free, anyone who is able to answer. I just want to get your perspective. In your organization, do you feel like customer aggression is increasing? And it's fine if you just want to say yes or no, but really great too if you have any thoughts on why that is, or maybe if you think it's not, why we think that it could be, or what is there a perception issue? I'm seeing some thumbs up. Yep. I'm seeing some hands up. Yep, cool. So if you put your hand up, I can't take you off mute. That's not a function that's allowed. So you do need to use the chat box if you wish to participate. Elaine said the number of incidents seem to be increasing. Yes, depends on the client. I agree with that. As patronage increases, so does damage. Yes. Definite increase since COVID. Yes, mostly drug related. In local government, it appears to be twofold increase in incidents and staff confidence in reporting. That's a fantastic catch there. And one thing that I always like to echo there is that sometimes the incidents seem to be growing dramatically, but what's actually improving is our reporting culture, and that more people are recognizing they can report this and they should report this, and they're not fearful of reporting it, and therefore it can look like our incidents are actually increasing, but sometimes it's really just the reporting is increasing. So not that we need to dismiss that by any means, but it's still an interesting factor to consider. We've got increased mental health issues and health system management. Agreed. A lot to do with societal issues, whether are deadlines the client executive has promised. Yeah, so there's a lot to do with there's a lot of factors, right? We certainly have seen across sectors that we work in a reported increase in antisocial behavior, aggression, and conflict during COVID and post-COVID. That's something that has actually been reflected in metrics. Now, unfortunately, there's a very wide spectrum of how well certain organizations will measure their exposure to aggression and violence. As we said, a reporting culture is crucial to getting those metrics in the first place. But like no one advertises how many times their staff have been assaulted. Unions sometimes are a little bit more forthcoming with those statistics. But it's a hard sell to try and say, come work for us. There's only a 30% chance you'll be assaulted. So typically those stats I hold in-house, but we will say with those clients we've worked with for a number of years that have kept good data, we are seeing increases. A flashpoint during COVID, I think for obvious reasons, but then even post-COVID, we're seeing a disproportionately higher amount of aggression being reported. Some of the stats we've seen, some extreme ones, like the FAA, so the Federal Aviation Authority in the United States, reported a 3,400% increase comparing 2021 to 2019, which is absurd. It's 34 times the number of incidents. That's an interesting one. Certainly, 2021 was still an intra-COVID year, if we could use that term, and aviation was particularly affected. So that's an interesting one. But we have seen the Retailers Association saying things like a 200% increase. So those are very, very substantial pieces of information. I do think, to some of the points made, we are more aware of customer aggression now. We are certainly incidents are being recorded more. they're being reported more, they're being filmed more, they're being circulated on social media more, and our brains aren't really well developed to figure out what is the actual increase as opposed to what am I seeing more. So therefore, that can sometimes distort our perception also. Great point just made about, in addition to physical assaults, chronic or acute exposure to verbal abuse can be just as detrimental to mental health. 100% agreed. It's one of the areas that we really try to focus on, and you'll see our model does try to work on is that actually just as a slight tangent, but in 2019 I was part of the research team for the Australian Security Research Centre who created Australia's largest multi-sector study into occupational violence and aggression. And one of the interesting findings was that the psychological cost and the morale cost, the emotional cost of continual exposure to low levels of what we consider less intense or less severe incidents of violence and aggression can sometimes be greater than the cost of those more severe incidents. Just a long-term build-up, and sometimes the cost is not well seen or observed, because it might not be someone taking stress leave or someone lodging an incident report. It could just be someone changing jobs or changing careers or leaving the workforce altogether. And sometimes that's not always readily acknowledged or even seen to be connected to a particular incident or a type of behavior. So there's a lot there that we can unpack. I certainly can. In fact, at the end there'll be ways. Sorry, I just realized I'm answering a question everyone's reading. The question was, are you able to share that resource, the study? Yes, I can. At the end, there'll be contact details for me. Feel free to drop me an email and I can send you a direct link. That's probably the easiest way forward. All right. So we've established that it's a problem. Obviously, you think it's a problem, or else you wouldn't have taken an hour out of your day unless you really like my voice and want to listen to me while you eat your lunch. But the question is then, how do we best address something? And our approach has always been system-based. So I love this quote from Peter Senge. Business and human endeavors are systems. We tend to focus on snapshots of isolated parts of the system, then wonder why our deepest problems never get solved. This is an interesting thing to reflect upon. If I think about my time as a private consultant and as a training provider, working in this space for a long period of time, I would say the majority of our clients, when they reach out for a quote on something, they reach out for a particular solution. We need a quote on conflict management training, or we need to do some de-escalation training, or we need a quote on a review of our security infrastructure. And that's fine, and we're more than happy to do those things. But sometimes I do wonder, is the answer further up the hierarchy of controls? Is there a better way to address this? Is there a more holistic way to address this than just this one particular treatment that you've identified? And sometimes it's a matter of that's what we can get budget for, and that's what we can get approval for, and that's what we need to go with because that's easy, and that's fine too. But I'm hoping that over the course of the next half an hour or so, that I'll present some ideas for you to consider also. All right. So one of the things that, again, we discovered during the study with the ASRC was that there wasn't really a very effective or widely accepted best practice model for how to prevent occupational violence and aggression in the Australian context. There were a number of models and resources and standards and so on that were based on the US context, which are still helpful, and certainly a lot of time and energy and resources have gone into creating those. But the context of what occupational violence looks like in Australia is quite different to what it looks like in the US, and therefore the way that our treatments are constructed, it should be different as well, or it's certainly worth considering whether they should be different. I'm not saying they necessarily have to be, but that we need to consider those factors. So just for reference, when we did that study, we looked at 6 industries. We looked at retail, hospitality, customer service, education, nursing and aged care, and private security. So that's where these findings have come from. So we asked ourselves, what would be what would a useful model actually look like? If we're going to create one, what would it look like? And the first one is it has to be comprehensive but accessible. So it can't be so complicated that a layperson or someone who from a connected profession can't read it and understand it. Because the reality is that the vast majority of organizations do not have workplace violence experts. They have a safety manager, a security manager, perhaps HR, perhaps legal, perhaps enterprise risk, but someone who's owning this portfolio that probably isn't an expert in human violence. So what do we actually do to be able to provide them some guidance to be able to steer in the right direction? So the first thing is it had to be comprehensive but accessible. The second thing is it has to be diagnostic rather than prescriptive. It's very hard to make a prescription of what someone should do without a full thorough understanding. And a model should guide you to asking the right questions, not necessarily tell you what the answers are, because the answers are so dependent on context, on nuance, on culture, on budget, on so many things that really takes a little bit more understanding to be too rather than being too prescriptive. We wanted it to be industry and environment agnostic. So we wanted a model that would work whether we're talking about rail, whether we're talking about healthcare, whether we're talking about journalists reporting from a war zone. Like realistically, we wanted a model that would actually work across those domains, any domain, because it's principle driven. Adaptable to all risk and threat environments. We wanted to be aligned to ISO 31000, so the risk management guidelines, and this is what we came up with. So believe it or not, it sounds so cliche, but this was taken from the back of a napkin almost. I don't actually write on napkins. I find them quite difficult to write on. But I was being interviewed on a podcast for a UK security podcast, and I was talking about this issue of occupational violence and aggression right at the beginning of COVID, and I was fleshing out just on a notepad in front of me some topics that I wanted to talk about and make sure that I got to, and I was just ruminating on what are the things that I actually talk to clients about when we're trying to address this risk. And I happened to write these a couple of terms in a circle. I joined the circle together. I thought, oh, there might be something to this. And over many hours of refinement later, we ended up with this model. So the holistic workplace violence prevention model, I will unpack it in detail. Don't worry about trying to read everything and understand everything right now. But this is essentially it. So you will see that we have an outer circle and an inner circle. So the outer circle, I call this circle the great enablers. The great enablers. So that is the committed leadership, supportive culture, honest consultation, and continual evaluation. The general guide, the general gist of this, I guess, is that if the outer circle isn't working, everything else gets harder. And if you've ever tried to influence change in an organization where you don't have leadership commitment, you'll know what I mean. If you don't have a culture that supports it, it'll be hard. If you don't engage in honest consultation, you're basically fighting with one hand behind your back. And if you're not continually evaluating, you might be fighting in the wrong direction. So it's really important that we have these enablers in place. So that'd be the organizational leadership. So for our committed leadership, that's not just that's at all levels really. So it has to be the organizational leadership. The risk owners must understand what their exposure is, but also the program leadership. As we get into this, you'll see that our goal is to build a workplace violence prevention, occupational violence and aggression prevention program, and that means that the person who is going to be leading this initiative or owning this portfolio needs to have personal leadership. They're going to need to influence people across various parts of the company that all have different priorities and different KPIs and different levels of interest. And we need to be able to lead people together to be able to achieve those outcomes. And the supportive culture, we need to have a no blame culture. This is something that I look as an outsider looking in. I think the rail industry has done a good job of is creating a no blame culture where people can report things without fear of repercussions. I'm not saying that's the same everywhere, obviously, just from those that I have seen. But we have to have a no blame culture. We have to have full buy in on the why. Okay, why is this important? People need to get it because ultimately, and I'm sure given the audience of RISSB, there are a lot of safety managers on board. You've probably all brought in some sort of steps or initiatives to improve safety and had pushback because in the short term, at least, it makes things harder or it makes things less efficient or people have to learn a new way of doing something and they'll push back on that. And if they don't understand why do I have to change the way I've been doing this for 20 years, then you're going to have more and more of that. So we have to make sure that all levels of the organization have bought in on why what we're doing actually matters. Why is it important? So that's important. And just as an example of how culture can undermine great safety initiatives, one of the things that I see organizations spend money on when they're concerned about staff safety is technology solutions. I'm not by any means saying don't spend money on technology. Just sometimes it's I find it's a bit of a quirk of human psychology that people will rather spend $500,000 on a piece of equipment that they can see and touch and show what they bought, rather than $500,000 in upskilling their staff, which you can't necessarily see and touch, but maybe has better impact. Well, it depends on the circumstance. Let's say that we have an organization that spends $1 million on a really state-of-the-art duress panic button system with great monitoring and communications and all the whiz-bang features, and they roll it out across their entire organization, and it's all going great. Fantastic installation, great product. And then when a staff member sitting behind a desk is yelled at or abused or threatened across their desk, and they press that panic button, and the system works and everyone comes running, and the situation is de-escalated. But then afterwards, that staff member is shamed for pressing the button because the situation wasn't really that bad. And did you really need to press it? That was a little bit of an overreaction. Guess what? That staff member will never again press that button. And all that $1 million you just spent has been a waste because no one's going to use it. Anyone who saw that person get shamed is not going to ever press that button. So now you've actually undermined that spend. So the culture is really, really important, and an enabler of anything that you wish to do. All right, so that was leadership and culture. The quality controls of the outer circle, honest consultation. So we need to involve all end users as best as possible. Let people have a say. Maybe the idea that you have sounds great on paper and you can't poke holes in it, but someone on the ground level might be able to tell you a very clear and logical reason why what you're suggesting may not work. Be open to that feedback. It's much better to find out in the planning stages than after you've spent money implementing. Minimizing groupthink and bias is also really critically important. I'm certainly guilty of this. We get together with people that are excited about this topic, that want to do the best we possibly can, and we come up with fantastic ideas, but we're all kind of aligned on what we think are the priorities, and that may not always map to what other parts of the business think are the priority items. So we want to try to avoid that. And as any part of risk management, we need to have continual evaluation. Is it working? If whatever changes we're putting in place, are they working? uh, and trying to avoid the sunk cost fallacy. Just because we spent money on something doesn't mean that it's working. And I'm sure it's been a challenge for many of you in your careers, where you're questioning whether something that was a very high ticket item has actually changed the risk, but no one wants to even engage in the conversation because they're terrified that it might turn out that was a waste of money, and no one really wants to know. So it's important that we are actually evaluating what's going on. And I think back to a healthcare organization that had an issue with people throwing seats in the waiting room in the emergency department. So their answer was to bolt down the chairs. So that they went to bolted chairs to the ground. This is a regional hospital, so everything was done a little bit ad hoc. So they got new chairs in, they bolted them to the ground, and then they couldn't get stretchers through on certain angles, and it caused all this issue, and it led to the maintenance staff actually unbolting the chairs because they were so sick of the issues with the stretchers. So important that we are actually evaluating our solutions and being able to see whether they're working or and make sure they're not creating new risk for us as well. All right, so let's get into the meat of it. As I said, the outer circle are the enablers and the quality controllers. The inner circle is really where the magic happens in terms of how do we address these risks. So starting at the top of the circle, we have systems. So our systems really are our policies, our procedures, our governance, our SOPs or standard operating procedures, and our governance structures. So depending on the nature of your organization, that could be quite different. It could be anything from an actual occupational violence and aggression policy. It could be a psychosocial health policy. You might have and probably should have policies around things like domestic violence in the workplace, responding to incidents of mental illness or drug and alcohol affected people, when to call the police, when not to call the police. All those kinds of questions really should be laid out in policy or in procedures somewhere, because ultimately, as we move around the circle towards training, it's very hard to train someone to a standard you haven't written. So it's very important that we do have these things documented. What I've found as a consultant is that oftentimes the bones of a good policy suite or procedure suite or document suite are there. They just need to be fleshed out. We don't necessarily need new documents all the time. It might just be an additional paragraph here, a couple of amendments here, and we can have something that's fairly workable. But it is a gap for a lot of organizations that haven't done a review in the last, say, 5 years or so. So once we've actually established our standards, the next step then is accountability. So who is being held accountable for when if these policies and procedures are not followed? So who owns the risk in this situation? Who is the PCBU? Do they understand their risk? Are they being informed about their risk, or are they just hoping that it doesn't happen? How are we actually auditing our compliance with our own internal standards? Compliance can be a bit of a dirty word sometimes because we always think about regulators, but we should be compliant with our own standards as well. Internal auditing and assurance is a critical component of risk management. And what happens if or when a system is not followed? So let's say that we have a great system for background checking to make sure that we are only hiring the right people into these roles. But then we've got a HR department that's under a huge amount of pressure because we're short staffed. We need people yesterday. And this person has applied for a role and they seem to have all the right quals on paper and they're warm blooded with a heartbeat and they're available right now and they don't do a proper background check. So, and then turns out that maybe that person wasn't suitable for the role. Maybe their resume was fictional. What actually happens then? And if we don't know what happens then, if we don't know who's held to account and why, and what our review process will be for that, then that's a gap that we need to be looking at. As we move around the circle, then we've got having a mentally healthy workplace. So that's where our psychosocial health initiatives have to slot in. What we do find is that while certainly we're not blaming anyone, we do find that sometimes conflicts in the workplace happen as a result of sometimes staff engaging in the conflict or participating somehow in the escalation or the buildup of that conflict. And oftentimes that's just because that staff member is under a huge amount of stress, or they're not managing things well in their own life. They get triggered by the behavior in front of them, and maybe they react in a way that they really wish they could take back, but it's then escalated a problem for us. Uh, and look, sometimes you'll find that in incident data, you'll see that a particular staff member is involved in a disproportionate number of incidents or complaints or so on, and it's important that we look at what's going on with that person. But my caution about psychosocial health is that it shouldn't just be about fixing people that seem to be broken. It should be about keeping people strong. It should be about looking at our high performers and making sure they stay that way. So what are we doing to proactively manage stress? Whether that's fatigue management, workload, if you've got shift workers, how are we managing their sleep quality and quality of life as they change shifts? How often are we changing shifts? How are we accommodating people's personal lives at work? All those kinds of things are worth considering. Creating a mentally healthy workplace goes a lot further than just having a pizza day once a month to talk about our feelings, right? It has to be embedded in the culture of the organization. There's no point having a break room with a PlayStation if you're expecting people to work 14-hour days and giving them a side eye if they say that they're tired. So it is really important that we're proactive about that. Are we creating safe systems of work so people aren't feeling stressed or scared about going to work? Certainly, some of I've heard through colleagues and through participants in courses from the rail sector that there is a level of fear and apprehension about the current situation with violent crime. Certainly, the unfortunate incidents in Bondi and in Sydney last week have added to that fear, and it's important for us to keep that in context also, without deviating and talking too much about that particular incident. But if we take the Bondi incident, for example, that was not an attack on Westfield. It was not an attack on retail. It was not an attack on the Australian way of life. It was an attack on people, and it seems in particular on women. So in that case, that incident could have just as easily happened at a train station. It could have just as easily happened at a public library. It could have happened anywhere there was a gathering of people. And something we all need to be mindful of is that there are people out there that, for whatever reason, may wish to do harm to others, and we should be taking appropriate precautions and controls to make sure we're keeping people as safe as reasonably practicable. And then our behavioral and personality assessments as well. Are we regularly checking up on our staff? If we're putting people into a conflict-rich environment, let's take our authorized officers, for example, people that may have to engage in conflict just as part of their duties. And I'm not saying dangerous conflict necessarily, but they're just asking someone for a ticket who may not have a ticket is potentially a conflict situation, just to take a very basic element of that job. are we checking that they are suited to that role? Do they have a personality profile that would allow them to be able to do that job? Firstly, do it well, and secondly, do it well over a period of time without a detriment to their own mental health and well-being. That's an interesting question. And if we're doing personality assessments or any kind of metrics at the beginning of employment, how are we checking up on those to make sure that person's still okay 12 months from now, 2 years from now? How are we monitoring their mental health as we go on? I'm not saying all of this has to be done at every level in every kind of organization. These are just questions to ask yourself about whether they're relevant to you. And then we move into risk-informed training. So this is where a lot of treatments do begin for a lot of clients. They want to engage in training, which obviously as an educator I love, but I'm also aware that training should not be cookie cutter. It shouldn't just be the e-learning course you can get cheap. It should be something that is risk-informed. It is informed by your actual risk exposure. So what are your people dealing with? What skills do they need? The question that's in the first dot point there, I do throw that out a little bit cheekily, but sometimes it's really important to ask a client or to ask yourself, are we trying to achieve compliance or competence? If it's compliance, if I just need to tick a box saying I offered this particular training to my staff, and our risk assessment says we have a compliance risk, great, compliance-based training is fine. If our risk assessment says we have a safety risk, I would argue you need to be looking more at competence rather than just compliance. And that might mean you can't get competence in a particular skill set with a 20-minute e-learning package. Maybe we do need to actually engage in face-to-face training with practical skills assessments, etc. But the devil in the details there, unfortunately, is that compliance and competence come at two different price points, and we have to be honest and realistic about what we're trying to achieve and what our budget will allow for. So the next part there is what training is actually required. So if I take rail just as an example, what training do our ticket sellers need, our station staff need? What training do our conductors need? What training do authorized officers need? What training do our corporate staff need? It's going to be different. It's going to be different across the board. So making sure we are really doing a training needs analysis and using that to inform what we do next to make sure we're not wasting time and energy and money, and especially the time of the people doing the training to ensure that they are getting the training they need. And we need to do those objective efficacy assessments as well, just to make sure that what we're doing is actually mitigating our risk and not just making us feel better. All right. Moving forward, animation paused. Security and safety controls. So this is our security by design. So the way our layout of our buildings, access to communication, SEPTED. So if you're not familiar, that's crime prevention through environmental design. So things like our lighting, our delineation of areas, our natural surveillance that is available in certain locations. All the things that we would be looking at from an engineering point of view when we're first designing a workplace. We'd look at all those factors there. But also we might be looking at guarding and protective security arrangements. Now, this is an area that I find sometimes has gaps for providers, or for clients that are looking at their providers, because let's take, for example, a security guarding contract. If I have if I am operating a train station and I know that there is a private security team provided by a major provider, do I actually know what those guards are trained to do and what their expectations are? And do they align with what my expectations of the guard's behavior will be and what my staff's expectations of that guarding provider will be? Because we've done a number of reviews over the years where we found that staff were horrified to find that the security guards' standard policy was observe and report. Do not get physically involved. Do not put yourself in harm's way. Do not intervene. Just be a deterrent. And if that fails, take notes. Now, that sounds harsh, but that's the reality of what most guarding SOPs actually say, because just like you, they have a duty of care to their staff and are not going to write an SOP that tells the guard to put themselves in harm's way. Now, that's fine as long as everyone's on the same page of what they expect the security guard to actually do when we have an incident. And sometimes the guard might have a lot of cognitive dissonance because they might feel ethically, morally like they want to get involved, but they're worried about their job safety if they do, or they're worried about their physical safety. Certainly, we've had a number of security companies reach out to us since the tragic event in Bondi last weekend, where unfortunately one of the security officers was killed, asking about additional training and what the guards could have done differently. And it's very hard to say at this point, but it is a concern. So we need to really be on the same page with whoever manages the security contract, as well as with the guarding company and with the guards themselves, and then make sure everybody knows what to expect based upon those discussions. All right. So then leads us into our next part of the inner circle, coming towards the end, which is intelligence and threat management. So we want to be proactive in our intelligence, and again, this is an area I think Rail typically does quite well. Is sharing information, being aware of crime trends on the network, where incidents are happening, what time of day they're happening, why they're happening, and being able to try to allocate resources around that. Performing threat assessments on whether it's a particular threat or a particular threat actor. Um, everything from the threat of terrorism through to individuals with a grievance should be considered as part of a threat assessment. And look, threat assessment and management is its own field of study. It's its own professional specialization. There are elements you can do without having that specialist knowledge, but sometimes it is important to really get an expert into it to assist with that. So once we have assessed it, we need to manage that threat. So what are the things we're going to put in place to be able to minimize exposure for us in this regard? And again, something I think rail does particularly well is intelligence sharing partnerships with police, with other rail operators, with other public transport operators in your area. Certainly, this looks different if you're a regional operator versus a metropolitan operator, or a light rail and heavy rail. All of these have different different aspects. And then as we finish up the circle, we have incident response capability. So what is our actual ability to respond in an emergency? Are we doing drills? Are we doing simulations? Uh, that's an interesting topic to talk about, it because how we do drills and simulations has to be based on our risk appetite. The most effective way to develop competence in responding to an emergency is to make the drill as realistic as we can safely. The challenge is the more realistic we make a drill, the more we risk inadvertently causing psychosocial harm, and also the more expensive and the more time and planning that has to go into doing the drill. So the reality is we can probably do a way more frequent, less realistic drills than we can with hyper realistic drills. So there's a risk that has been managed even just with how we do those drills and simulations. Certainly, there's been a number over the last let's say the last decade or so that I can recall, where they've done things like active armed defender drills in a train station or in any other workplace, and maybe not everyone was notified, and it's actually caused real fear and damage and harm to somebody who walked in on this drill thinking it was real. So there's been a number of cases like that. So we have to be really mindful of how we do those simulations, and who we can push and who we can't, and how we manage that risk. It's not a cut and dry, just do it as realistic as possible. That's not always the answer. Um, Use of personnel. So who's going to be doing what in an emergency? If we're talking about a risk on board a train that is moving, that's going to be different to at a station. It's going to be different to on board a stationary train. So how we do those things needs to be considered. So that would include both our internal personnel, AOs, as well as other station staff, and perhaps even vendors working out of train stations as part of a broader incident response capability. And then relationship with our first responders, again, something rail typically does fairly well, based on some relationships that have been built over the years, is having that good relationship with police, with fire, with ambulance, and making sure there's a good familiarity and assistance forthcoming should it be needed. And also just considering in remote areas, as I mentioned, we work closely with the V-Line and have done for a number of years. There are very extensive stretches of rail where a train and therefore the staff on board could be quite isolated from police assistance, and maybe from assistance from anyone else either. So how they manage those risks is also worth a consideration. And then lastly, post-incident management. So after we've had an incident, making sure we have EAP, and having EAP is obviously as well as a fundamental as far as I'm concerned. But do your staff know what the EAP is? Do they know how to access it? Are they worried about accessing it because they think they're going to be discriminated against later? Those things need to be considered. What's our internal investigation capability? So the investigations, I think most of you would have the ability to do a safety investigation. Can we do security investigations? What does a workplace violence incident investigation look like? How does that work in conjunction with a safety investigation or the police investigation if it was an assault, for example? Be able to answer those questions is important. And if you don't have internal capability to do a proper investigation, how do we outsource it? Who are we outsourcing it to? How do we do debriefs? So I do find that some industries struggle with the concept of debriefing, especially in an industry like rail or like our clients in the aviation sector, where downtime is so incredibly expensive that there tends to be a lean towards, is everyone okay? Everyone's fine. Okay, back to work. We need to keep moving. And we don't always capture those critical debriefing conversations as well as we should. And sometimes the debriefing might take weeks to occur, and at which point we may have lost some of those immediate recollections. People may not be speaking up. And also another factor of debriefing that is sometimes lost is that a debrief immediately after the incident is not the end of the process. The debrief immediately after the incident should be followed up with one a couple of weeks later, maybe even a couple of months down the track, because especially if we're talking about something like PTSD or post-traumatic stress or trauma responses, those sometimes will take time to appear, and we need to make sure that everyone is okay over the long term, not just in the immediate aftermath. Once we have debriefed and captured learnings from our investigations, the debriefing process, etc., we need to have a way of presenting those learnings to make sure they're actually captured, they're documented, where we come up with ways of trying something new if we're seeing a trend, and then of course monitoring whether those new initiatives are working, whether they're driving down any number of incidents or severity of incidents or perception of safety or whatever metric we're looking to influence. So that's the post-incident management. I'm sorry I've been talking a lot, although it is a one-way webinar, so it's kind of part of the gig. But I really wanted to get you through that model inside the first 45 minutes to allow us some time for Q&A. So this is the whole model. I'm sorry if you came looking for a particular answer that I just need to do this. Unfortunately, it's just more complicated than that. You need to be able to assess where are you weak, what is the area that's going to have the most bang for buck for you to fix, and it might be something like, hey, we just need to work on our culture. Our culture is undermining everything else. All the other pieces are kind of there, but they're not really supported. How do we do a big culture piece? Or it may be very tactical for you and say, look, we're not doing a great job of training our staff to manage these particular things, and we need to just really ramp up our training, and that could be fine too. The reality is most of the time it's a bunch of things. It's a combination of those. You might find that, and look, every organization is different, every industry is different. Your incident response capability, or maybe let's take intelligence, threat assessment, and monitoring. That's a common one. It's commonly something that Australian businesses are weak at because it's not part of our general organizational structure to have intelligence and threat assessment capability. But for the vast majority of industries, they don't really need it either. So that might only be a 2 out of 10, but a passable score would be 3 out of 10 for that industry. So they're not far off. But maybe training or psychosocial health, their passable score for that is 8 out of 10, and they're currently at a 4. So maybe that's a higher priority. So these are just things to think about. It's a framework to help you have better conversations, to engage more people. Because if you look across this spectrum, this is not something that your safety team will have the ability to control on their own. It's going to include safety. It's going to include security. It's going to include enterprise risk. It's going to include legal. It's going to include HR. There's going to need to be stakeholders from all different aspects of the organization to truly do this the most effective and efficient way possible. Reality is some people will not participate, and you will not get buy-in from everyone you want to get buy-in from. We can work towards that, but just being realistic with you. So how do we work around that? How do we make things palatable for those that maybe don't buy in on this risk or think it's just another thing on their plate? So there's a lot to unpack. I would love to be able to answer some questions for you if you want to put them in the chat box. But just while you're thinking of questions, a couple of parting thoughts to leave you with. This is bigger than one person. It's bigger than one team. It's bigger than one discipline. We have to work together on this. If we fundamentally care about our staff's well-being and making sure that people get to go home safely, then we have to work together on this. It cannot be just the domain of safety, because you don't have all the tools. You don't have all the influence. You need to be able to work across domains with people that actually care about the outcomes. So if nothing else, take that to heart. It's a complicated topic. No one person knows everything. I've been studying workplace violence for 20 years. I have read everything there is to read on it. I've run a podcast, the Managing Violence podcast, where I interviewed world leaders in this field and learned something new every single conversation. So there's a ton of information out there. Don't feel bad if you don't know where to start, because there's an awful lot to learn. And of course, as we know, the reason for staying safe at work isn't really at work. The reason for staying safe at work is at home. And it's one of those things that I think we have to emphasize, that it's about making sure that all of our staff don't just not come home with bumps and bruises, but they come home as loving, attentive parents, and as siblings and as friends, and are not changed by what they experience at work. And that's really ultimately the goal. So I'm just going to leave up this slide. This is my contact slide. Feel free to connect with me on LinkedIn or any of those contact points there. But on that point, I will hand back to Sharon to facilitate Q&A.
Thank you, Joe. Thanks for that very informative session. I think there are some questions in the chat box. I'm just going to read one from Omi. I hope I got your name right. Omi would love to hear your views on the efficacy of customer violence and aggression behavior change campaigns, and keen to understand your views on this.
Yeah, look, that's a broad topic. There's certainly been some effective campaigns. I know that Queensland Rail have run an effective campaign around What's Your Plan B, which I think has been quite well received from what I've heard. I haven't worked in the house to know, but from what I've heard, it sounds to be well received. And it really, that was just about getting staff to consider always what's their backup plan. If this doesn't go well, do I have a plan B? If I don't have a plan B, then perhaps plan A isn't really something I should be thinking about right now. That can be effective in terms of campaigns targeting customer violence or targeting the customers that are trying to get them to rethink their behavior. If I can speak freely, I would say usually they're a band-aid on a gunshot wound. The people that are actually causing the harm usually aren't responsive to a sign telling them to not be aggressive. I would say that it does serve a purpose as a reminder for the quote unquote general punter who maybe is having a stressful day, that might be just catching themselves and considering their own behavior. I think, while I think it's a positive initiative and it creates a conversation and it allows staff to know that that kind of behavior is not tolerated, the actual impact on the perpetrator is minimal, because usually people that are worked up to the point where they're going to be abnormally aggressive beyond their normal behavioral standards are not they're actually too emotional to be self-reflective and consider their behavior. So I don't know that they actually work that well. I'm certainly open to data that proves me wrong. I would love it if that was the case, and that's really low hanging fruit and easy things that we can do. But I think it very much depends on what our goal is with that. If the goal is just to increase the amount of conversations and reporting, I think they do a great job. If the goal is to stop people becoming aggressive, I'm not sold.
Thanks, Joe. I think Martin also posted some thoughts rather than questions. I do have one question for you, just hearing, you talk about and referring to the Bondi Junction sort of tragedy, that after sort of significant public events like that, where people get fairly jittery, going to the mall can be a dangerous thing. What role can public transport providers play in messaging around providing assurance both to their public, their patrons, and even their frontline employees around that? Or should they even sort of respond? Does it make it worse?
Yeah, that's again a really great question. And unfortunately, again, the answer is it depends. I wish I had cut and dry answers for you. Look, I think it's you're right. The general public is a little bit more on edge. We saw this after the Burke Street attacks in Melbourne. We've seen this after Lint Cafe. People fundamentally are on edge when their safety is threatened, or when they feel like they are less safe than what they previously thought they were. There if you've been around this industry for a while, you may have heard the term security theatre or safety theatre or risk theatre. And basically the idea of the theatre component is it's doing things that create the perception of safety that don't necessarily really change the risk. Right. So maybe we're going to put up the signs, or maybe we're going to put up plastic like plastic barriers between staff that are supposedly going to keep them safe, but they, as soon as someone hits them, they're going to fall down anyway, right? But it might make people feel safer, and it might create the perception of safety. I don't necessarily, I don't necessarily think that's always a bad thing. I think if we have a limited ability, or whether that's through finances or time or responsiveness, if we can do something that makes people feel safer, sometimes that's a win, even if it doesn't fundamentally change the risk. So, for example, the in the Westfields in Queensland over the past week, there's been a dramatic increase in police presence. Now, the chances that someone's going to do a copycat attack in a shopping center when there's full of police is pretty small, but it made people feel safer. So the fact that, as I said, this wasn't an attack on shopping centers; it was an attack on humans. It could have easily happened at a childcare, like it could have happened anywhere.
I
So,
guess, sorry to
yeah,
jump in, Joe, but I guess, just hearing you, Martin does have a question that
sure.
does having security staff present, does that present an escalation issue in itself? I guess it's what you're talking about, the
Mm.
Westfield having more security presence. Does that actually make the matter sort of worse?
I think that's a fear that is largely unfounded. I think it depends on how your security are presented and what their role is. If security are inconveniencing people at the front door because they're going to wand everybody as they walk in, then you probably will end up with an escalation of incidents that wouldn't have otherwise happened. But if your security are just a presence and they conduct themselves professionally and respectfully, I haven't seen that really result in additional issues. There's also the question of how you actually dress your security. So, for example, we were working with Services Australia with Centrelink, and they were looking at taking their security officers out of uniform and putting them into Centrelink uniform. And it's just a way of they were still there as security, but it just changed the perception of them, and it wasn't a trigger for people that may have had a bad experience with law enforcement in the past. And that was an interesting trial. It seemed to work out well in certain locations. Other locations, the more overt presence was better for them. So
Thank you.
I think there's two sides to that. And I think that actually probably leads nicely into Paul's question about body worn cameras I just saw pop up.
Yeah.
Um, Again, I think body worn cameras is very much. I think I'm a fan. It's just they have to be implemented correctly, and by correctly I mean they need to be standard and not made a fuss over. And I think the narrative has to be very clear when someone asks what's that for. The narrative has to be it's about making sure everyone stays safe. It's about my safety, but it's also making sure that myself and my colleagues speak to you respectfully. And if at any stage you feel like one of our staff has not treated you correctly, there'll be evidence to support that. And just to make it clear that it's a two-way street, if people think that the cameras are just there to catch them out being naughty, then they're going to be more aggressive about it. So it's
Thank you.
very, 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 very important the narrative is clear on that.
Thank you. I think we have time for a quick answer to one last question there. Is in the chat box from Tom about any thoughts around focus on addressing perceptions of safety rather than or in tandem with treatments to actual physical threats.
Yeah, yeah, I do, and I'm conscious of 6 minutes left.
That's right.
But I think it's always in combination. As I said, my background was psychology before it was security. People's perception of safety changes their behavior. We don't want to create a false illusion of safety, but if people feel safer, they tend to conduct themselves in a more in a more appropriate manner. People that feel unsafe tend to attract predators and can also be defensive and hostile in their own right. So I think that it's a combination of two things. The point you make about bright lights creating shadow areas, etc. That's a design feature. Then we need to figure out how we address those shadows. But I think in general, if people feel safer, also potential perpetrators will identify that area as being a harder target area. So they'll go somewhere that's going to be less problematic for them to deal with. So generally speaking, a perception of safety has an overall net positive. What we need to make sure we don't do is just put in the low hanging fruit that makes people feel safer without actually continuing work in the background on things that are going to change the risk factors. So it has to be a double-edged sword.
Thank
Or
you.
two-pronged strategy. I think that's probably a better analogy than a double-edged sword.
Yeah, I think we're running out of time, and people are sort of starting to drop off. I just want to thank Joe for sharing your, not just information, but sharing your thoughts and discussing this model and sort of what you've seen in the industries or various industries. I think it's a very important topic, but it's also a very, I guess, emotionally charged topic as well. So thank you for sharing your thoughts. I think this rounds up the webinar masterclass today. I think we have another masterclass in a couple of weeks, and I hope you all have a fantastic week. And this recording should be available pretty soon on our website and on YouTube, I believe. So thank you very much for your time, Joe, and thank you very much to all our participants today.
Thank you. Absolute pleasure.